Hello, my name is Dr. Chioma Udemba, and I work with a company called Greenlight out of North Carolina to lead conversations with communities of color about the COVID vaccine, going through the myths, and trying to address whatever questions that I can to help people make decisions from a place of knowledge. Because there's a lot of information that we get from the news, from social media websites, from our friends, from our families, and it can be very confusing. Some of that information can be misleading, misinterpreted, purposefully misinforming the public. And so I'm trying to provide a space where we can have these conversations with a provider who is knowledgeable in the background of the COVID vaccine and the virus itself. So earlier in the pandemic, when the vaccine was first being brought out, we were seeing a lot of information talked about people being really concerned about the vaccines, about serious side effects, about getting COVID from having the vaccine. And people were either saying, I'm definitely not going to get it. I'm only going to get it if I absolutely have to get it for my job. I'm just going to wait and see what happens. And there was a lot of early information saying that people of color were less likely, more hesitant to get the vaccine. And it makes sense because Black Americans in this country have been faced with a lot of barriers when it comes to not only healthcare, but the justice system, the education system. And so there's a lot of issues when it comes to trust in those spaces, especially among marginalized communities like the Black and Latino community. Comparing them to their white counterparts, African Americans were kind of initially very kind of concerned about getting the vaccine, understandably. But I think as time has gone by, there's been a lot of concerted effort from groups like the one that I work with, Greenlight, and national groups, so like the HHS, which is the Health and Human Services Department of the federal government, actually put out, information, leading town halls, sending out providers of color to help address these concerns. And we've definitely seen that there's been a significant increase among African Americans in their willingness to receive the vaccine. We're actively doing everything that we can to really address and adjust those that are more understandably concerned about getting the vaccine. But there's still a lot of people that are out there that are still not ready to receive the vaccine. And there's a lot of different information that's out there about what those people look like that are not quite ready yet. Mostly these people are kind of in the middle age range. They're unfortunately kind of dividing themselves along party lines. So more likely to be Republican or conservative. They are likely to be a little less educated as far as kind of how far they went in their schooling. So more likely to have just received a high school degree instead of being somebody that's gotten a college degree or at least gone into some college. My goal today is really to just address those concerns about misinformation, about this misleading information that's out there. So hopefully as you make your decision about whether or not you're going to get the vaccine, it's from a place where you've kind of heard from a physician that looks like you, that comes from your community, that that really addresses those things that make you want to wait and see or say definitely no. So let's go right into it. A lot of people are saying, I'm being used as a guinea pig, or it's just a government's way of keeping tabs on me. That they were made too fast, or they're just kind of pushing this out here to take advantage of us while we're vulnerable and desperate. So when it comes to any medication that hits the market, the vaccines are no different to that. They have to go through these different phases to get approved by the Food and Drug Administration, the FDA, to be given to Americans. And the vaccines, like I said earlier, were no different. So they also had to go through rigorous testing. So there was the research that said, okay, you know what? There is a new way of making vaccines that are really effective, that help to prevent people from getting sick from the bacteria, viruses, and things that are out there. And that's that mRNA technology that's being used by Pfizer and Moderna for their vaccines. They go through clinical trial stages. The first part of it being phase 1 looks to say, okay, is this vaccine safe? So healthy adults put their body, their lives on the line and say, you know what, this is a new medicine, but I know it's important. Use me. And so they use that person, they inject them with the medication to see, okay, what kind of side effects will somebody get if they get the vaccine? If it shows that there's not any serious side effects, no serious harm, they go to phase 2, which is, okay, does this medication in this instance, vaccine, actually do what it's supposed to do: prevent people from getting symptoms of COVID and getting sick, ending up in the hospital or dying from COVID. So that's the second part of the clinical trial. And again, these are healthy adults, so not just like the general population, but healthy people that volunteer to be the guinea pig. And if the vaccine does what it's supposed to do, then they end up in phase 3, which answers both questions. So does the vaccine at the dose it's supposed to be used in the general population not only do what it's supposed to, but not cause any serious, life-limiting, life-threatening side effects? Once all of those testing levels happen, the FDA goes and says, okay, let's go back and review your data. Is what you're saying what we see in the data? So they have experts in virology and immunology in the making of vaccine, and in public health in general, look through the data and say, okay, yes or no, what the company is saying, what the results are, is reflected in this data. And once all that happens, they go through an additional review and say, okay, yep, the vaccine is safe. The vaccine does what it's supposed to do, which is prevent people from becoming sick from the COVID virus infection. And then they say, yes, it can be given to the general public. So all of those steps happen for these clinical trials. The guinea pig part of this is done. Once it's been approved by the FDA or given this emergency use authorization, the part of the guinea pig stuff is done. But they do continue to monitor to make sure that the medication and that the vaccines are safe and they are continuing to be effective. One thing that I do really want to point out is, unlike most clinical trials that happen for medications that hit the market in the United States, the vaccines by Pfizer and Moderna, and even Johnson and Johnson as well, did rigorous kind of efforts to recruit people who are from marginalized backgrounds. So when you look at the breakdown of who was a part of the clinical trials, again, those guinea pigs, those healthy volunteers that put their body on the line to see if the vaccine actually works, you see that a big portion of them are African American, are Latinx. And it's not just like 80% white, which is what you'll see in a typical clinical trial. And definitely, I think Johnson & Johnson actually went out of their way to kind of partner with institutions, HBCUs, to again recruit and patients from communities of color. One thing that I will say is a little different from the vaccines that we're using right now for COVID versus a regular medication is that because of the significant health crisis that we're in when it comes to this global pandemic, they did adjust the timing in which things normally go. The medications that we're using right now for COVID are under this emergency use authorization because it is an emergency. We need some way to reduce the spread of COVID, reduce the amount of people that are dying and being hospitalized. And so it's not fully approved. Because we're in a global pandemic, it's under this EUA, emergency use authorization. When the pandemic ends, they'll still have to go through the full approval process. And really the only difference is that you'll see here, instead of being kind of one step after the other, they kind of group the step. And the step that's being grouped here is making the vaccine. So there's nothing different as far as going through the different processes of the clinical trial. What they did is, while actively going through the clinical trial, they also figured out a way to create enough of the vaccine to distribute. Because if you remember earlier on, after the vaccines were approved, we had to kind of stagger who received the vaccine because there wasn't a lot of it already made and ready and available to the public. And that's because it takes them a while to make the medications. And it was not a step that was skipped. It was a step that was kind of done at the same time. So no steps were skipped. The normal process was done. Healthy volunteers put their bodies and their lives on the line. The government's not trying to track you. They're trying to help save lives. The next big concern that we get is, what are the side effects of this vaccine? People are really concerned about waiting and seeing what happens because they're worried that what if something else happens? What if something different comes out that we didn't see earlier? And again, like I talked about before, when it comes to those clinical trial phases, the biggest thing that they look for, the first question is it safe? And they continue to watch and see after it's hit the market, monitoring to see kind of what side effects do people have. And they'll adjust and make not only the public know, but the providers that are providing this vaccine aware of what things to look out for. Some people are concerned about it making them infertile or changing their DNA or getting COVID from the vaccine or getting, some sort of serious side effect that would cause them to die. Let's start off with the first thing, which is people don't want the flu vaccine because they think it's going to give them the flu. Let's talk about the same thing with this COVID vaccine. So when it comes to the COVID virus, there's all different parts of it. You have the outside part of the virus where these blue little spikes are in it. And you have the inside part, which has all of its genetic information, which it uses to make more copies of itself, which ends up making you feel sick. The spike protein are these little spikes on the outside that allows the virus to make its way into our healthy human cells. And then this inner part, which is the virus's genetic information, contains the RNA and these nucleocapsid proteins that, again, like I said, allows the virus to make copies of itself. We get vaccinated against the spike protein. So our body, our immune system can recognize the full virus unopened outside of our healthy cells and kill it before it causes any sort of infection, before it invades our healthy human tissues. And that's what we get the vaccine against. This inner part is, again, that genetic information. It's actually how we test to see whether or not somebody has COVID, that PCR test, that swab test, that antigen test. We're looking to see if there are any copies of the genetic information of the virus. None of that's in the vaccine. This is the part that makes you sick. This is the part that the virus uses to get into your body. So there's no part of the vaccine, any of the vaccines that are on the market currently available, that have any portion of the virus that makes you sick. So you cannot get sick by getting the vaccine. What it does is prepares your immune system to recognize the virus before it invades and gets inside of your human cells without you having to actually get exposed to the virus. Your body makes these antibodies against that spike protein. And then when you see the virus in its full live form floating around in your nose and your mouth and the back of your throat, it can kill it and attack it before you have to get sick. There's 2 different vaccine platforms on the market. You have the mRNA vaccines, which are made by Pfizer and Moderna. And then you have the viral vector, which is made by Johnson & Johnson. One of the big differences is what age groups has been approved to use those vaccines. But the other big thing is how they actually teach your immune system to respond to the virus. The mRNA uses this genetic information, this messenger RNA information, to train our immune system to recognize that spike protein on the outside of the virus. Once our body gets this mRNA, it recognizes it as not being human. It creates antibodies against it, makes immune cells that will respond to it if it ever sees it again, and it clears it out of our body completely. There's no part of this genetic information that gets incorporated into our own DNA or lasts long in our body. Now, instead of being kind of free-floating genetic information, the viral vectors, like the Johnson & Johnson vaccine, actually uses something kind of like a Trojan horse. On the outside, it looks like something we know, like a horse, or in this case, the common cold virus. And on the inside, it has that genetic information about that spike protein. Now, our body says, oh my God, that's the cold. I know that's the cold. Let me go out there and let me attack this thing and get rid of it. It breaks it open and it says, oh my gosh, there's something different on the inside, this genetic information about the spike protein of the COVID virus. And it makes antibodies against that. Again, all of that material is broken down and cleared out of your body because your immune system recognizes that as not being human, and it goes away. But what stays is that immune cell, those antibodies against the spike protein. So now in both cases, our immune cells are trained to recognize the spike protein on the outside of a COVID virus, so that next time your body gets exposed to the virus, it can see it, catch it early, clear it before you get seriously sick and end up in a hospital or dying from the infection. Now, we're activating our immune system. So we're saying, okay, we're going to make some immune cells, some infection fighting cells. You might notice some side effects, which are common and expected. Obviously, you get an injection, so you're going to notice some pain and swelling at that injection site. But again, because we're activating our immune system, we might notice some fever, some chills, some tiredness, a little bit of headache. But those are things that you can treat through and they're gone within a couple of days. But if you notice something more significant or symptoms of the COVID, it's probably not related to the vaccine itself. It might be related to you getting either exposed to COVID or another virus, or something else might be happening. And that's when you reach out to your doctor. The CDC and the FDA are continuously tracking and trying to recognize if there are other safety concerns from either of these vaccines. And they're recognizing it and keeping track of it through a program called VSafe. And people go back whenever anybody puts any symptoms and they say, how many people have noticed these symptoms? How long after their vaccine did they get these symptoms? Are these related to getting the vaccine, or is it just a coincidence? We all know the story about the Johnson & Johnson vaccine, where there was some people that recognized that they were having an issue with their immune system being activated in an abnormal way, causing low platelets and issues with clots. The FDA recognized that because people were reporting these symptoms. They stopped the vaccine from being administered. This is an example of the system and the process working. They went back and they said, okay, who is more likely to have these side effects? Is this something that's really related to the vaccine? Is this risk high enough that we need to pull this medication off the market? They did all of that review and they said, you know what? It's a very, very low risk of this happening. It is safe to continue making sure this medication is being given, but let me make sure that the providers that are giving this vaccine and the general population is also aware of this very low risk. 7 in 1 million cases that this happens. Very, very low risk. And if you compare that to the risk of getting COVID and getting infected, the scale kind of tips in favor of still getting the vaccine. Same thing with the Moderna and Pfizer vaccine, where we recognize that some people can have a significant or severe allergic reaction called anaphylaxis from getting that medication. Again, it's very low. 2 in the case of Moderna, 6 in the case of Pfizer per 1 million doses that are given, or the likelihood of having that. Everybody's being monitored to make sure. They say, hey, providers, watch out for this reaction. If it's going to happen, it's going to happen within a half an hour to an hour after they get the dose. So let's make sure we know to look for this. And again, the risk of having these reactions is much lower than the risk of you getting infected from COVID and ending up in the hospital and dying from COVID. One of the last kind of big kind of groups of concerns that people have about, getting the vaccine is what happens afterwards. I'm healthy. If I get COVID, I'll be fine. I'm not going to get too sick from it. Or people are concerned that, I've already got the COVID virus infection. My immune system will recognize it. I've got natural immunity. There's a lot of concerns and questions about how long the protection will last. Do I need booster vaccines? Will it protect me from variants as well? So all these questions are really, really good questions to have about vaccinations. And some of these questions, as scientists, as physicians, as providers in the community, we do have answers to. Some of these questions we're still trying to figure out the answer to. One thing we do know for sure is these vaccinations are a newer element that adds on a layer of protection against the COVID-19 virus. So we have our face masks, our social distancing, practicing good hygiene, hand hygiene, getting tested, recognizing our symptoms, staying away from others when we don't feel well, making sure we're in environments that are safe and that are allowing, reducing the spread of COVID. All of these things, when we add them on together in our lives, are reducing our likelihood of getting infected from COVID. So the vaccines can't stand alone, right? The face masking and the social distancing can't stand alone because we tried all those things separately so far, right? We tried to just do the social distancing and the face mask. We still had a lot of spread of COVID. We added on the vaccinations, and then we said, okay, go out and see what the world would be like. And we realized not enough people have been vaccinated. So it's not enough. All of this stuff by itself is not enough. But if we add it all together, I think we'll really see a lot of reduced COVID infections in our communities. And until there's been enough people in our communities that have received vaccinations, we really can't remove additional layers of protection. Okay. Now, one thing that I definitely want to talk about is these variants that are out there. What we did notice is that, okay, this virus has mutated, just like every virus does, right? This is why we're having to change our flu vaccine every year, because the flu virus changes and mutates. It's a normal part of a virus. As it's kind of growing and changing and multiplying in our bodies, it has to do so really quickly. And it makes a lot of mistakes when it's copying itself. And that DNA, that RNA, the genetic information within the virus that's being copied, some of that information gets altered or lost or changed as it copies. And that creates a new mutation. And some mutations that the virus made are helpful for the virus. It allows it to become more easily infect our cells. Some of those changes are not as helpful. It might allow them to be more easily infect our cells, but it might make it more easy to also kill and die. So there are different types of mutations and variants that are out there. The virus mutated, and there's a and so we call it a variant. There, we have different names and grading of those variants. And the CDC and the WHO, which is kind of the whole world's kind of version of the health department, is actively tracking this. They're looking to see what are the different mutations that this virus has caused. We give them a name, so now it's called a variant, alpha, and it's Greek alphabet, alpha, beta, lambda, delta. And then we track and we see how many people are getting infected by this specific variant of the virus. How many people are ending up in the hospital or dying because of this new variant? What countries have which variants? Now, earlier in the United States, we weren't really tracking to see which variants we had. So who knows? The Delta variant could have been here the whole time. We just didn't have the resources or the interest in tracking that. But now we see that there's a lot of the Delta variant is on the rise. Now, this Delta variant is a little bit more easily able to infect our cells. I haven't quite done enough studies to see whether or not our vaccines are as effective against them. There's been some other countries that look to see for some of the other variants that, yes, the Pfizer and Moderna vaccine actually help to protect against it. The Johnson & Johnson vaccine, some people have also kind of looked to see how well that vaccine works in certain countries that have, a higher rate of a certain variant. But overall, what we're seeing in the medical community is that even though these mutations are happening, creating new variants of this same kind of COVID virus, and some of those variants make it a little bit easier for the virus to spread in the community, overwhelmingly, the people that are getting infected by these newer variants, ending up in the hospital and dying from these newer variants, are people who did not get the vaccine. So there is some protection that we're definitely seeing from people getting any of the vaccines. And one big thing that I wanted to kind of point out and to note is that these variants are happening because as the virus is in our body and it's adjusting and it's replicating and it's growing, if you don't have the vaccine or a really strong immune system out there to help clear and get rid of the virus really quickly, the longer it's in your body, the longer it has time to mutate and change. And then if you're going out without a mask and you're exposing yourself to other people, then you're spreading that new variant. And so, again, the things that are going to help us to reduce the amount of variants that are in our community, reduce the spread overall of COVID in and of itself, is adding on those preventative measures. Getting the vaccine so that our body can quickly recognize and clear the virus before you get sick, before you end up in the hospital, before you're dying. Wearing a mask. Again, so we can, prevent you from either getting infected from COVID from somebody who isn't quite symptomatic from their infection, and also prevent you from spreading it to somebody who could get the virus. Social distancing and avoiding crowded spaces where you don't know the vaccination status of others that are out there. Being in well-ventilated areas, washing your hands, practicing good hygiene. The biggest thing that I can say when it comes to making a decision about getting the vaccine and wearing a mask is do what makes you feel comfortable, right? So I'm fully vaccinated. I've been fully vaccinated since February, but I care for patients that have no or low immune systems. And so regardless, until the community rates of vaccination and spread of the virus is low enough, I continue to wear my mask when I'm in public in crowded spaces because I want to reduce the risk of being asymptomatic, not having symptoms, and giving COVID to somebody in my community. And the same thing for you and your household. Make that decision individually for you. Look at the information that's available for free on your state health department website or on the CDC that tells you how many people in your area have had COVID, how many people in your area have been fully immunized, that received 2 doses of an mRNA vaccine or 1 dose of the Johnson & Johnson vaccine. How many of those people have done that? And then making that decision in that space about who's around me. Are there people that have not gotten vaccinated that live around me that I regularly, socialize with? Are there people in my home that are unable to get the vaccine, so young children? Are there people in my household who, are most likely are at high risk, who have other health conditions that will put them at risk of becoming really, really sick and dying from COVID? And all of that information together should help you decide, okay, you know what, I think it's worth it to get the vaccine, add on that layer of protection to prevent myself and the loved ones that I spend time with from getting infected. And again, I should definitely, wear a mask when I'm going out. 'Cause I don't know the status of everybody else. I just know for me and my household what we do. So again, adding that protection, wearing a mask, social distancing, not going to that cookout, not going to that barbecue, not going to that party, because I don't know everybody's status, whether or not they're symptomatic or not, whether or not they have that variant or that virus or not. So I'm just going to add on this extra layer of protection for me and the people that I'm regularly kind of socializing with without a mask. Hopefully this all was really helpful for you. It's really important that we get this information out there. There's so many different ways to protect ourselves against this virus. I think one of the best ways to do that is getting the vaccine. If there are other concerns that I didn't address in these few minutes, please let me know. I'm happy to address those. Thank you and have a wonderful rest of your day.